Malignant mucosal lesions. We wrap up our discussion of mucosal lesions by learning about malignant conditions. When cells of mucosal lesions do become cancerous, they are now malignant and follow the progression of cancer development as is seen throughout the body. The following graphic shows four overarching stages of cancer development: hyperplasia, dysplasia, in situ cancer, invasive cancer. To summarize the graphic, hyperplasia is often an initial stage in the development of cancer, characterized by increased cell reproduction rate. Dysplasia, or the abnormal development of cells, can lead to the variety of the conditions and precancerous cells. In situ or regional place cancer refers to the cancer cells that have not spread beyond their formation site. Finally, as indicated by the image, invasive cancer marks when cancer has officially grown past the original tissue and has entered blood or lymph to travel. The malignant mucosal lesions to know for the INBD are carcinomas, which are cancers of epithelial tissue, and melanoma, which is the cancer of the melanocytes. While not covered in this section, leukemia is a cancer of blood cells, and sarcoma is a cancer of tissues. Oral basal cell carcinoma. True basal cell carcinoma of the oral cavity is extremely rare, must know caused by sun damage. BCC has an ulcerated erythroplakia appearance. Metastasis is extremely rare. Treatment: simple surgery to remove lesions. OBCC history. Carcinoma. Basal cell carcinoma of the oral cavity is extremely rare, caused by sun damage. BCC has an ulcerated erythroplakia. Oral melanoma. Melanoma frequently impacting the hard palate and maxillary alveolar mucosa. Must know a malignancy of melanocytes, the dark purple black lesions metastasize more rapidly than other malignant mucosal lesions. Treatment: while excision, continue follow-ups. Oral melanoma, oral squamous cell carcinoma, exophytic or ulcerated erythroplakia or leukoplakia growth between vermilion border and junction of the heart and soft palatis, or posterior one-third of tongue. Must know this condition is caused by oncogene and tumor suppressor gene inactivation, which is driven by use of tobacco and alcohol. HPV 16 and 18 have been identified as risk factors for oropharyngeal cancer. Plummer-Vinson syndrome has also been identified as a risk factor of OSCC and is a condition including mucosal atrophy, dysphagia, and iron deficiency anemia. Plummer treatment: excision or cancer radiation therapy. OSSC, oral squamous cell carcinoma, oral verrucous carcinoma. A variant of OSCC, OVC account for 2 to 12% of all oral carcinomas. Must know caused by chewing tobacco and HPV strains. 16 and 18 has low exophatic growth and appears whitey and pebbly. Treatment: surgical excision. OVC, surgical rate 15-100 in cases that have not spread the other side. Oral melanoma 10 to 25%. Connective tissue conditions. Have completed a detailed discussion of mucosal lesions. We can now travel one layer deeper and discuss different connective tissue conditions. Specifically, this section will consist of information about benign and malignant connective tissue tumors. Connective tissues are particularly interesting because they can be divided into two overarching categories: reactive or forming as a result of reacting to the trauma, a neoplastic or new or an abnormal growth. Because there are many types of connective tissue, a further distinguishing category characterizes the condition based on the connective tissue type. One last piece of the information to note that is that because the connective tissue is deep and up to the mucosal membrane, its condition often appear as lumps and bumps in the mouth. Benign cystic tumors. Connective tissue conditions: leiomyoma, neoplasm, new or abnormal growth of small muscle cells; lipoma, neoplasm of fat cells, most common on buccal mucosa; rhabdomyoma, neoplasm of skeletal muscle cells; denture-induced fibrous hyperplasia lesions that result due to the poorly fitting denture. Must know there are two main types of this condition: epilis fissuratum. Epilis fissuratum occurs at the base of the vestibule. Papillary hyperplasia occurs on palate, more likely due to poorly cleaned dentures. Fibroma, denture-induced fibrous hyperplasia. Fibroma, a benign fibroid tumor caused by chronic trauma or irritation, are among the most common benign connective tissue tumors. Must know, also known as a hyperplastic scar, irritation fibroma, or traumatic fibroma. The tumor is specifically known as the fibrous hyperplasia of oral mucosa. Fibromastosis, neoplasm of fibroblast. Must know, a difficult to eradicate condition that often recurs even after treatment. Fibromatosis. Gingival hyperplasia, the enlargement of the gingiva. Must know, this condition occurs as a side effect of DCC, dilantin anticonvulsant, calcium channel blockers, and cyclosporin and immunosuppression. This condition is very high yield for INBTE. Treatment: gingivectomy, discontinued drug use if possible. Gingival hyperplasia. Granule cell tumor, neoplasm of the squamous cells, the cells forming the myelin sheath in the peripheral nervous system that most commonly occurs on anterior dorsal tongue. Must know, called a granular cell tumor due to the granular cytoplasm of the tumor cells. Pseudoepitheliomatous hyperplasia is this tumor resulting in a highly proliferative appearance, mimics squamous cell carcinoma. The tumor variant on gingiva is congenital epilis of newborn, no PAH, but everything else is similar to granular cell tumor.